Today my topic, high risk pregnancy. Hi, I'm Dr. Madhvi, Senior Obstetrician and Gynecologist, Consultant in Pratima Hospital, Kukatpally. First, any patient coming to the OP after missing the periods, we need to segregate them from the low risk to the high risk. Why we need to segregation? We need to see their age. If they are below 18 years, that is a teenage pregnancy. If they are above 35 years, that is elderly priming. There are so many risks and we need to see the weight. If the BMI is above 35, that is also a problem. They can land up in diabetes, hypertension, and so many risk factors are there. On top of that, we need to know their medical history. Like previously patient is a diabetic or the hypertensive or the asthmatic patient or epileptic patient, whether she is using any drugs for it. Because some drugs which cannot be used in the pregnancy, and or if she has any immunological problems, whether she is taking any drugs for that, or arthritis patient, if she is taking any treatment, because few drugs then they cannot take in the pregnancy. So we need to segregate them, whether they belong to the high risk or where, at what level we have to deal them. And why? Because the patient, diabetic patient, if she is a diabetic before her pregnancy, whether she is using the medicines properly or not, if that HbA1c, I mean to say the first 3 months, if the diabetes is over diabetes, the HbA1c is more than 10, they can land up in the congenital anomalies of the baby. If she is a hypertensive baby, is a primary hypertension is there, we need to use the drugs which can be used in the pregnancy. If she is an asthmatic patient, few drugs only we can use in the pregnancy, like arthritis patient, or previously epileptic patient, some drugs we cannot use in the pregnancy because those tablets, she can land up into the congenital problems of the baby. So those patients compulsorily, if any medical complications prior to the pregnancy if they have, they need to see to the doctor, gynecologist before conceiving. On top of that, and we have to ask the patient whether she has gone any ultrasound scan before, because some things we can see only when they come conceive. When they do the scan, that time they will come to know that they have the bicornuate uterus, unicornuate uterus, ectopic kidneys, and fibroid uterus. Those things to deal in the pregnancy is very difficult, because if she has 4-5 fibroids, on that if she conceives, she'll be having the severe pain during the pregnancy. So these are all the things we know. And on top of that, we have to know the hematological history also, whether there's a sickle cell anemia patient or the thalassemia patient. According to that, we need to maintain our HB and all that. So all these things we need to know, because these patients, they need a special care, special support for their delivery, and those patients need the proper infrastructure in the hospital. Like if there is a placenta previa patient means the placenta implanted on the cervical os. That's the most dangerous obstetrical complication in the pregnancy. Those patients, they need more of blood. If there is a twin pregnancy cases, those patients, they need proper specialized care. They need to monitor properly, and that is very, very important. And as the normal antenatal care which is needed for the low risk patient, like up to 7th month, every month they need to attend, and after 7th month every 15 days, in the 9th month every week, where it is totally different in this high risk group patient. Every 15 days they need to come, they need to know the where they are landing up and what the nutrition they need, how they are taking the tablets, whether their tablets are controlling the disease. All these things has to be monitored by the gynecologist and other staff, and they need to be in the proper books of a doctor, like where she is going and how everything's monitor has to be done properly. So infrastructure is very much needed in the hospital, like blood bank, gynecologist 24 hours around, anesthetist and the pediatricians are need to be available. With all this support, they can have a good, healthy mother and healthy baby. That's why I just want to deal this high risk pregnancy cases, and I want to tell to the people so that they can segregate by themselves whether they come under low risk or high risk. Thank you, one and all.